If we've brought somebody out of the water that is not responsive, they're not breathing, we need to start some CPR. Very important that we get help on the way, so make sure somebody has phoned 000. Now, safety equipment is always important. If you have gloves, get your gloves on. If you have a face shield that may be on your key ring, use that as well. Now, once we have them out of the water, we're up onto a safe area. We need to make sure that their airway is clear. Open the mouth and have a quick look. If it looks clear, tilt the head back, get down close, look, listen and feel. If they're not breathing, we're going to start some CPR. Heel of the hand, center of the chest, 30 compressions. We're going to go at around about 100 to 120 beats a minute, 1/3 the depth of the chest. We're going to continue our 30 compressions and then we are going to deliver a couple of rescue breaths. In delivering the rescue breaths, pinch the nose, tilt the head back, and breathe. When we breathe, we only want to breathe to get the chest to move just a little bit. Not too much, we don't want to overinflate. Just a little bit of movement in the chest, straight back to our 30 compressions, and we're going to continue on. Once we've done our next 30 compressions, we're going back to our breaths. Now, it's important to understand that CPR should be continued until such time as either the person recovers, help turns up and takes over from you, or you're physically unable to continue on. These days you'll actually find public access defibrillators at many places, whether it be shopping centres, train stations, cinemas, buildings, surf clubs, gyms, wherever it may be. Very important to get those defibs onto somebody as soon as you can. Now, if that's the case, anybody who is unresponsive and not breathing normally requires defibrillation. The defibs themselves are very, very simple to use. It's a matter of turning the defib on. From there, it will guide you through the process of what we need to do.
Remove clothes from patient's chest. Look carefully at the pictures on the white adhesive pads.
The pads have directions as to where they are placed on the body. We can place one down here at the base of the rib cage. This pad will go up here, and now the machine analyses the heart rhythm. It is really important at this stage to make sure that nobody's touching the person.
Analyzing heart rhythm. Shock advised. Stay clear of patient.
Once the machine has now said shock advised, our orange button is flashing. Make sure everybody is standing clear and we'll deliver the shock.
Shock delivered.
It will remind you to make sure that 000 has been called, and then we'll go back into CPR.
Be sure the ambulance service has been called. Start CPR.
Just like we did before, heel of the hand, center of the chest, 30 compressions. 1/3 the depth, between 100 and 120 a minute.